Thanks for staying tuned. The silent crisis unfolding across Nigeria's public health institutions involving resident doctors continues to generate concerns, and it is no different in the Niger Delta. Countrywide, resident doctors issued a fresh 30-day ultimatum to the federal government demanding resolution of long-standing arrears, better working hours, recognition of credentials, and salary structure reviews. With this broad crisis, it is impossible not to see who are the real casualties in all these. We'll examine what's fueling these recurrent industrial action, its risks for patients, and what it reveals about governance in the health sector. Let's see how we can examine the systemic gaps that turn doctor discontent into public health emergency, especially when we look at how it affects patients across the Niger Delta region. Now joining us live, President Association of Resident Doctors, UUTH, Dr. Promise Jacob. Thank you for coming on the program.
Thank you for having me.
Thank you for coming around, Doctor.
Thank you.
Well, I'd like us to set some context now. What is really driving these incessant strikes that we keep seeing in the health sector? It is becoming very, very concerning, especially when we look at, international best practices and what is supposed to be obtainable in the health sector. It's as if we're not making progress. And the persons that are bearing this brunt, including patients, also the health practitioners themselves, if they're not happy, the patients cannot be well. What is going on?
Okay, what is happening in the health sector? It's what we see lack of political will from government in addressing issues pertaining to the health sector. And first, if we look at the health sector, yes, it's a place where the common man goes to. And when we also look at the government, people don't even patronize the general hospitals, that's the public hospitals. It's just where the common man goes. And if you also look at the 2001 Abuja Declaration of the African Union Heads of States that said that 50% of the annual budget, so 15% rather, of the annual budget will be given to health. But in Nigeria, we've not had up to that. If you look at even our budget structure, it's hovering between 4% to about 6% annual budget, which is also not helping to fund the health system. And if it's not funding the health system, we'll have problem with infrastructure, we'll have problem with manpower, also have problem with remuneration in the healthcare system. Because if you talk about global practices, there are things that should be put in place to ensure that we also meet those global practices, which will be the environment, which also comes in motivation of the healthcare workers. But unfortunately in Nigeria, we're not doing that. And also with all the agreement reached with federal government and also state government too, that they don't keep to this agreement. Like we still talk about agreement from 2009, 2014, and the rest. And even currently with the process of the bargaining, that's
the trust fund
yes,
conversation?
Yes, with the federal government. So far, right now, they've put a hold on the negotiation because of trust issues, that the federal government has its own agenda different from what the health workers are also looking at.
So, Doctor, how often have the health experts been meeting with the federal government before it gets to this level? Because hasn't there been meeting, negotiations, and to see how this can be sorted out?
Okay, there've been meetings, in short, even before I started the practice of medicine. And they've been meeting.
How often?
One thing about government is that when there is a threat for industrial disharmony, they call people around. Okay, what are the problems? Let us look into it. And you reach an agreement. Okay, we set a time frame where some of these things will be achieved. But unfortunately, those time frames will elapse and nothing is being done.
No follow-up.
No follow-up. That even when we send reminder letters and the rest, they just tell you that they are working on it. But on the ground, we are not seeing anything.
All right. Well, the crisis that we see in the health sector, like a lot of critics believe, is not just national. It is also here with us in the Niger Delta, and even specifically here in Akwa Ibom. Uh, could you bring us up to speed with some of those realities currently? Uh, Maybe in the institution where you work and the health practice in the state, in the Akwa Ibom state now. Recently, the governor declared a health emergency in the health sector, and this is supposed to address some of the issues that are bedeviling the sector. How is that effort coming along? Are there hiccups? Are there holdups?
Okay, for what the government did in Akwa Ibom State, the declaration of the state of emergency, and also set up committees to also look at the states of the hospitals and everything. And you could also see that the government has also tried in the primary health sector, that's primary health care, where they've started renovation and also um, promised to employ about 2,000 healthcare workers. That will also boost manpower. And as at yesterday, I think information I got was that the governor has also approved the new allowances, salary increment for the state government doctors and also the healthcare practitioners in Akwa Ibom State. I think these are some of the factors that can be put to mitigate some of these issues. But let me come down to UUTH, that's University of Uyo Teaching Hospital, where I work. Currently, the resident doctors are on strike. And what are the problems? Problems with salary, problems with not moving from one level to another after duly promoted or passing of exams, and also salary arrears, shortage of manpower, then poor equipment of our core room where we sleep in during maybe core hours like in the evenings and night, and also the house officers' quarters where it looks so inhabitable. And now we look at somebody employing someone since March 2025, and it took them about 7 months before they could pay their first salary. And even that, the salary was not paid correctly. They placed them on the wrong entry scale. And when we complain, oh, that they will work on it from March till date, it was just recently yesterday that we got the letter to correct the wrong entry point. And now the salary issues, we're still not talking about it, that, oh, they will need to send the letter back to the federal government to make those corrections. But there are still salary arrears. And also there's a salary arrears of 2023. This is over 2 years now. October 2023, October, November, December, till date, that salary has not been paid. And members that have moved from one grade level to another are still receiving the salary of the previous level where they are for about 4 to 6 months now for some persons. We're saying no. Nobody is asking government that give us new allowance, increase our salary at the moment. That discussion is also going at the federal level. But here we're saying that what we have worked, what we're entitled to, why not pay us?
Is this an issue that the government should be blamed for, or is it an internal issue? Can we clear that up?
Okay, it's both ways. It's both ways because the hospital management has a role to play because they also represent the federal government in the institution since it's a federal institution. So when they employ, we said they are employing based on the directive of the federal government. And we're like, even the directive of the federal government in other institutions, they start people on COMMERCE 3, step 2. Why here in UUTH, they started on COMMERCE 2, step 2. And we're like, why the disparity? That you can't be the only center in the country doing the wrong thing. And when they also asked for other evidence, which we gave them from other centers across the different geopolitical zone, where they employ resident doctors and also doctors on the COMMERCE 3, step 2. And it took them that we had to go on strike before they could correct that.
But doctor, what I want to understand, have these issues been reported to the national body of resident doctors, and what effort have been made to see how this can be sorted out?
Okay, when issues start as a local problem, you first try to resolve it in your local way. But the national, they are also, we keep them abreast on every action that we take and also for guidance. So for the national, they are aware of our struggle. They are aware of the strike. They've also, in their own way, intervened too in this issue, and also will be taking it up again with the minister and also the head of service, so that this issue that is starting in Uyo will not spread as a wildfire across
Because
the
it's becoming
country.
national. When you talk about strike, everybody's affected.
Yes.
Everybody's affected.
Well, let's look at this and the structure, of course. Is it possible that there could be a cog in the wheel of the operations within UUTH that maybe stifles the possibility that your demands get the swift responses that they need?
Yes, if the hospital, because for the past, like I said, since March, we've been dialoguing, they've been making promises that it will be corrected, and we've also been following them. That okay, just do this thing. We'll finish all the dialogue to a point that we got to a point that like it's as if there is no willpower to do that. And when you talk to the Federal Ministry of Finance or Federal Ministry of Health, they are like, we have a hospital management, that the hospital management should take it up. And one will tell them, okay, take this thing up at that level and discuss the challenges that we have. They're like, oh, they've been doing their best, they've been doing, but we are not seeing results. Mm-hmm. And that's why the Congress...
This affects selected health practitioners within the institution, not everybody.
Yes, it's just the resident doctors.
Because it affects only the resident
doctors.
Yes,
it affects the resident doctors.
So how long is this strike? Is it like a warning strike?
No, it's an indefinite strike.
Indefinite?
Yes. We'll finish the warning strike.
How has this affected operations so far? I mean, patients, the UUTH, I know, usually has an influx of patients, and it would be really difficult at this time. How is the hospital coping?
It's actually very difficult this time, and we sympathize and also empathize with the patient. But unfortunately, you know that if one is not properly motivated, the person cannot give his best to the patient. And imagine someone being owed salary. How do you expect the person to come to work?
Well, let's look at the broader spectrum of what your demands are now in clear terms. What are the grievances, and what steps are you hoping can be taken immediately towards ensuring that these issues are resolved?
Okay, the grievances, at least there are, we gave 7 problems. That one, it's that our members that were employed in the wrong entry scale, that the employment later should be withdrawn and a new employment, a fresh one, should be reissued carrying the correct entering level. That is one. Then 2, it's that also because of the wrong employment later, the salary is also affected, and they place them on a wrong salary scale because of the wrong employment later, and that should be corrected. And the salary arrears they are owing to these persons that were employed in March, stay owing them between March and July, that they should pay them. And also there's a shortfall of August and September because of the wrong salary scale they placed them. So that should also be corrected. Now then, in other one, then we also have our members that have been upgraded from one level to the other. Those, it should reflect in their salary. And the arrears they're owing our members in 2023, that should be paid. Then also we have manpower shortage. And if we look at even at one of our demands at the national, it's that a doctor should not work for more than 24 hours without a rest or a break. But in University of Uyo Teaching Hospital, in some department, especially some department in surgery and other departments, where you have one doctor in a unit, that may not happen, because if we want to bring that now, it will shut down the department, and we are ready to do that because we've been losing colleagues all over the country because of burnout. And also there's also medical errors and negligence, all because of burnout. So if a tired doctor is a dangerous doctor, so you cannot be blaming the doctor that had not slept for the past 72 hours and you expect that person to give maximum. So the chances for negligence, the chances for medical error will increase. Statistics has shown that once there is burnout, once there is increased workload, that medical errors increases. And we don't want that for Akwa Ibomites or for Nigerians. We want to take care of every Nigerian and want to give them the best health care that they could ever receive. But the government should also increase the number of doctors or healthcare workers so that all these will be taken care of. Then also our call rooms. If you get to our call rooms, it's not as cozy as this studio. It's so hot, mosquito infested, rodents, even some places that you even have reptiles around there, and it's not safe for us. So we're saying make the call room safe for us to rest. Then the house officers' quarters, where they sleep, where they stay, it's also, we have reptiles, rodents, and the rest. Like, make the place safe for everyone to stay so that we can give the best care.
All right, doctor, since the commencement of this strike, has the hospital management reached out to the association to see what they can do to start the process?
Yes, they've reached out, and one of them, that what was done yesterday was to reissue the employment letter, the new employment letter, carrying the correct step.
That has been
That
taken
has,
care of.
yes, I have seen that. And as at today, we are also to inspect the call rooms, all the call rooms, with the hospital management to do a need assessment on all the call rooms.
All right.
And I think also as a follow-up, they will also be sending the employment letters, the reissued employment letters back to the IPPIS office so that they can effect the correction.
So must we get to that level before these things are put
Well,
in?
President, Association of Resident Doctors, UUTH, Dr. Promise Jacob, I really wish we could continue, but then we're hoping that these demands that you've put out to the public would be addressed by the quarters involved, and they take your demands and wishes more seriously. Thank you very much for coming on the program.
Thank you so
And
much.
continue,
very
please
much for
continue
your
the
time,
good work
Doctor.
you're doing.
All right, thank
Don't
you.
be discouraged.
All right.